quick demo on the ABRA abdominal closure system Dr. Ronahan is currently using. What we are trying to do is we're trying to get primary closure of the fascia, and in order to do this we use elastomers and buttons with button tails on them. So the elastomers actually go through the skin, through the fascia, to the other side of the abdomen, up through the fascia, through the skin. So you have an elastomer. This is the skin where my top finger, my pointer finger is, and my little finger, that's going through the abdomen. And with every respiratory breath, it's cycling, because we have contracted, retracted tissue, and that's what we're trying to get back to midline. So with every cycling of the respiratory breath, you're getting the release of the calcium in the actual muscle, the fascia, and that's allowing it to come back to midline. So with that being said, the nursing detail that would need to be known about these button tails is that they look like this. They're silicone, and they actually go right on top of the elastomer, and they're tightened down with just a simple click. I don't know if you can see that. I will take it off and I'll make this really where you can see it better at the end of the video. The doctors will come in and check to see if it's 2 times stretch. That's something that the doctors will do. Nursing, if there's any oozing around the elastomer underneath the button tail, we want to keep that as dry and clean as possible, because you have pressure, and if there's any moisture, then that's going to cause a pressure problem with the skin. It could cause the skin to start breaking down. So that's what we want to avoid at all costs. So you can take a Q-tip and clean. You can lift the button tail up just slightly and clean underneath with a Q-tip. It can be a dry Q-tip. It can be a wet Q-tip with half peroxide, half water. Just want to make sure that the button tails stay at a 90 degrees angle with the elastomer. You don't want it going forward or backward. You want it straight up and down. That's something you will never have to adjust. The doctors will adjust that. Okay, the button tail that is going to hold the anchor in place is attached at the very back, and it's an upward and forward motion, and it clicks. You will hear an audible click. I'll go over this again up close so you can see it. You actually want to hold the button tail in place and pull down, and it will attach like that. You only want to change these if they're wet or if they become compromised, so that they're not sticking at all. If you have 20% holding it down, don't mess with it, just leave it alone. But if it does come loose and it's not sticking, then you'll need to replace it. There should be a pack that goes to the room with the patient, and just replace it and make sure that it's completely and firmly stuck to the IO band that's underneath on the patient's skin. Okay, there's an audible click, and then you just bring it up. Okay, so the button tail. I don't know if you can see this really well. If you can see, there's just there's a lip there. Can you see that? So the button tail is going to go in all the way forward, this direction, and it clicks. To take it off, you're going to do it this way and back.
Oh, it's on this current.
Okay. These are on the instructions for use as well. So if you have any questions about actually how to do it, you can go back to and refer to that. If anyone has any questions, please do not hesitate to give me a call. I'll be happy to answer questions at any time. Zach will have my phone number. Please call me if you have any questions. Thanks.
Thank you.